As the U.S. continues to fight COVID-19, we're facing another battle containing a newer, much more contagious strain. We've been talking about this. A report earlier this week claimed the new variant doubling every 10 days. Joining now to explain is the president and CEO of University Hospital in Newark, New Jersey, Dr. Shereef Elnahal. Dr. Elnahal, welcome back.
Thank you so much for having me.
So, Dr. Elnahal, let's begin with the vaccine right now. How has the administering of the vaccine been going so far? Because I had Governor Murphy here the other day, and it seems that people are really frustrated with trying to get an appointment.
Well, the overall vaccine administration is going much better. We're getting more efficient. Every site in New Jersey, and I think across the country, is getting more just better at it. And so we're now at 1.5 million vaccinations a day, which is actually right around Biden's goal. President Biden set that goal, which was actually a revision up from 1 million per day at the beginning of his administration, knowing how fast we were going. That said, the demand still far outweighs the supply because the categories of people that are eligible for the vaccine were vastly expanded. And so until that supply catches up, and I know that the Biden administration is doing everything they can to do that through the Defense Production Act and getting manufacturing up, we will see some folks who are dissatisfied.
And dissatisfied just because of the process, though. They're saying they can't even log on. They can't get a person on the phone. I don't know if you're having any issues in Essex County where you represent. Are you hearing anything like this?
Well, we chose to go with our own scheduling system, Dan, but yes, the state scheduling system is going through some difficulties. I know the health department and so many others are working hard to fix that, but I know that a lot of mass vaccination sites have other alternate ways to schedule. So please look that up because there are other ways to get in.
Good to know. Maybe they should follow what you guys are doing. As we said, cases related to more contagious variant of the UK strain doubling every 10 days. I don't want to be an alarmist here, right? But what are you seeing specifically in Newark, and how big is the concern about this?
Well, one concern, Dan, is that we don't have the capability of sequencing the test samples on a mass scale yet. We should be really testing 5 to 10% of all tests for these variants, and we just don't have the infrastructure in this country to do that yet. So the real answer is we don't know for sure if these variants are rampant in Newark, but we have a feeling they might be because we're seeing an increase in hospitalizations in our hospital. Could be one of many reasons for that. But I will say that it is concerning that it could become the dominant strain across the country by next month. And there are things we can do about it. Social distance, masks, stop the spread, but also develop the capability to test for these variants so we know where they are.
So you can't test for it yet, where you are?
No, of course you can in certain labs throughout the country who have the capability of doing that, but we really should be expanding that capability across the country.
So talk to me then about the relationship between the new variant and the vaccine. Do we know for sure that the vaccine can handle the new variants?
We have a lot of evidence that shows that the vaccines that are approved now are effective against the new variants from the UK to an extent. It may not be exactly as effective, but the whole point is if you are protected even at 70, 80% effectiveness, that really helps. It really prevents severe disease and hospitalization outright. And if you do get COVID-19, it's a much less severe case than otherwise. And so it is still effective against the UK variant, but what it does is it pressures all of us to vaccinate people even faster because the virus is spreading faster.
Understood. So specifically at University Hospital, you said you saw a rise in hospital admissions. So do you suspect then, I want to make sure I'm clear on this, that it's related to new variants, or could this just be more widespread spread?
I think variants do have something to do with it. Likely, we have many dozens and dozens of known UK B.1.1.7 variants in New Jersey. What that means is that there are probably many, many more cases of the variant that we don't know about because we don't have the capability of doing mass sequencing. But I will say that there are a lot of factors unique to Newark and cities like it that just portend for greater spread in general of COVID-19 in communities of color as well. So that definitely is a factor as well.
Dr. Elnahal, appreciate you explaining some of this and appreciate your voice this morning, as always. Stay safe to you, okay?
Thank you, Dan.